you definitely have been hearing a lot of talk. Have you had anybody come into you yet asking about it?
Oh, yes. I mean, every day we get many patients to come in with a lot of concerns and a lot of fear. But the bottom line is we just have to really be very vigilant and make sure that everyone is safe.
Okay, we have a couple questions from some viewers here.
Yeah.
One of the questions that a viewer asked was, what is the risk for pregnant women?
Well, I mean, pregnant women, just like the rest of the society, a lot of it depends on their vulnerabilities. They have other medical conditions that could make their immune systems a lot less. But while you're pregnant, it's really important to try to stay as well as possible, because now you're caring not only for yourself, but you're caring for your child that's to be born. So if someone is out there and they're pregnant, I say they follow the precautions that we advise very strongly for people who are advanced in age, people that are 60 and 70 with comorbidities. Try to stay away from crowds, places where there are a lot of gatherings of people, because that gives you a higher chance of contracting this virus. And for a pregnant person, not only will it be dangerous for that person, but it would be dangerous for their baby as well.
And what about for people who have long-term chronic health conditions? What about them?
Right. Now, according to the World Health Organization and all the other organizations that, put out the guidelines, this population should definitely be cautious. Stay away from big crowds. Like, for instance, I did a story last night with our station about how they canceled the St. Patty's Day parade. And a lot of people are upset about it, but at the same time, what I mentioned was the fact that it's all about public safety. And when you get big crowds of people, everybody's, together. And the problem with the coronavirus is, in a lot of cases, people who have this condition, they don't have a lot of symptoms. I mean, the World Health Organization put out that about 80% of people who contract this virus, they're very mild to moderate symptoms. So you might have symptoms of allergies like itchy eyes, maybe a cough and a sneeze. It could very well be coronavirus. And because you're young and healthy, we don't know. And the testing is very limited right now. But you may be what's called a carrier. And then you go to these big parades or whatnot, these big assemblies of people, and you're exposing people with these chronic medical conditions. And the problem is if they get the virus, they don't have the strong immune system. They can't fight it off. And this is the scenario where some people are losing their lives.
Yeah, especially the older population, people 65 years and older. State Department of Health just saying that they're suggesting people who are 65 or older not go to any of those crowds of more than 250 people. So keeping everything small, right?
But not only that, a lot of the nursing homes, like Whitfield, they have a nursing home there. Some of the nursing homes in the area, they're limiting people from coming to visit because they don't want to expose these seniors to these medical, to this possibility of contracting this virus, because as I said, a lot of them have chronic medical conditions as well, like heart disease, lung disease, maybe survivors of cancer on immunosuppressant medications. They can't fight it off as well, and they're more vulnerable, and they can lose their lives.
All right, so everybody out there, again, wash your hands, cover your mouth when you are coughing or sneezing, and then also making sure that you cover your mouth, and you also wash your hands very well.
That is correct.
All right, thank you so much,
Thank
Dr.
you.
Quinn. We'll be right back after the break.